Do you know what isolation precautions are and why they are crucial in healthcare settings? They are a set of protocols designed to prevent the spread of infectious diseases, safeguarding both patients and healthcare workers. These precautions come in different forms: standard, contact, droplet, and airborne, each tailored to combat different modes of transmission. As we delve into each type, you'll see the recommended personal protective equipment, or PPE, for each. Isolation precautions are protocols designed to prevent the spread of infectious diseases in healthcare settings. Let's start with standard precautions. In the realm of healthcare, these are the basic level of infection control that should be used in the care of all patients, all the time. The cornerstone of standard precautions? Hand hygiene. It's as simple as it sounds, yet it's incredibly powerful. Washing your hands effectively and frequently can help prevent the spread of many diseases. Another crucial part of standard precautions is the use of gloves. Gloves should be worn when there's potential for contact with blood, bodily fluids, mucous membranes, non-intact skin, or contaminated equipment. Remember, gloves are not a substitute for hand hygiene. They should be removed and hands should be cleaned before moving on to the next task or patient. So, remember, standard precautions apply to everyone and every situation involving potential contact with bodily fluids. They are your first line of defense in preventing the spread of infections. Next, we have contact precautions. Now, these precautions step up the game a bit when it comes to preventing the spread of infections. Contact precautions are specifically designed for diseases that are transmitted through direct physical contact or via contaminated surfaces. You might be wondering, what does this mean? Well, if you're dealing with patients who have infections like methicillin-resistant Staphylococcus aureus, also known as MRSA, vancomycin-resistant enterococci, VRE for short, or Clostridium difficile infections, often referred to as C. diff, you'll need to take contact precautions. This means you need to add a gown to your standard precautions. Yes, a gown. It might seem like a lot, but remember, it's not just about protecting you. It's also about preventing these infections from spreading to other patients. So, in cases of direct contact or surface contamination, don't forget to add a gown to your standard precautions. Now, let's move on to droplet and airborne precautions. These precautions are about dealing with diseases that are primarily transmitted through the air, whether via droplets or smaller airborne particles. First up, we have droplet precautions. These are for diseases that spread via large respiratory droplets expelled when a person coughs or sneezes. Think of diseases like meningitis, pertussis, or influenza. The key here is to use surgical masks in addition to practicing standard precautions. The mask acts as a barrier, protecting you from inhaling these infectious droplets. Next, we have airborne precautions. This category includes diseases that spread through tiny airborne particles that can linger in the air even after the infected person has left the room. We're talking about diseases such as measles, tuberculosis, or varicella. For these, you need to step up your PPE game and opt for N95 respirators or hoods in addition to the standard precautions. These are specially designed to filter out these minute particles and prevent you from inhaling them. Remember, the type of mask or respirator you use can make a world of difference. It's not just about putting on a mask, it's about putting on the right mask for the right situation. Whether it's droplets or airborne particles, always ensure you're using the right type of mask or respirator. To summarize, isolation precautions are an essential part of patient and healthcare worker safety. We've delved into the 4 types: standard, contact, droplet, and airborne precautions. Standard precautions, which include hand hygiene and gloves, are applicable across all scenarios. Contact precautions, involving the addition of gowns, are for diseases transmitted through direct physical contact or contaminated surfaces. Droplet precautions, requiring surgical masks, protect against diseases transmitted via respiratory droplets. Lastly, airborne precautions call for N95 respirators or hoods for diseases transmitted through airborne particles. Each type of precaution involves different personal protective equipment, or PPE, tailored to the transmission mode of the disease. However, these are just the minimum requirements. Depending on the specific situation and risk assessment, additional precautions may be necessary. Remember, while these are the minimum PPE requirements, additional precautions may be necessary, depending on the specific situation and risk assessment. Always prioritize safety and follow the guidelines provided by healthcare authorities.